and good morning. This is Eric from Spo2 Medical Services. Now what we're aiming to do today is talk about chest assessments in trauma, and this is going to be aimed at our EMT and first responders that are watching. So yes, there are different chest assessment models out there, but the chest assessment system that you use needs to be appropriate to your skill level. So we need to be able to fix what it is that we're finding, or potentially, if we do find something, recognise the severity of it to highlight it to a clinical grade that can deal with it. So you'll be aware of other models out there, such as 12 flaps or rise and fall. This system that we've developed is just aimed at your EMT and your first responders. So without further ado, I'm going to introduce you to RIBS A. So that's RIBS with two S's, A. And what this is first of all, we start with R, which is the rate of breathing. Now to count the breathing rate, we're going to look at either counting the breaths over 30 seconds and timesing it by 2, or we can count it over 15 seconds and times it by 4. And what we're aiming to do is identify the person's average breathing rate over a full minute. Now, the gold standard would be to count it over a full minute, but in the interest of being prompt, bearing in mind we are in a trauma primary survey when we're doing our breathing assessment, these are two options that you can use to rapidly gauge whether someone's breathing too fast or too slow. Next is I, which is injuries. And we're looking for injuries to the front of the chest, the back, and the sides. So that's physically exposing the chest, getting hands on, and really looking and really being curious, really looking everywhere for any concealed sort of penetrating injuries. Looking for any pattern bruising developing, and looking for any sort of bony deformity along the actual rib cage itself. Next, we're going to look at comment on the breathing effort. So is it rapid, weak breathing? Is it ragged, sort of laboured breathing, etc.? But we're looking at the person's breathing effort at this stage. The first S is for symmetry. And what we're looking for here is, if we're looking at the patient's chest wall, so if this is sort of from the feet looking upwards at somebody, and this is the chest, what we're looking for is that on both sides there's equal rise and fall of the chest, so it's going up and down equally on both sides of the chest. If we had asymmetry of the chest, then that could suggest that there is either air, blood, or some sort of mechanical impedance affecting the sort of effective rise and fall of that side of the chest, and therefore lung expansion. The next S, quite simply, is putting our Spo2 probe on. So that might be as part of a larger monitor, or it might just be a finger probe. And remembering that ideally, in the non-COPD patient, we're looking for oxygen saturations above 94%. And at this skill grade, we'd expect you to be thinking about 100% oxygen as routine for your major trauma patients, or for those less traumatically injured, oxygen if their oxygen saturations are below that 94% threshold. And then we have a bit of a break, and then A. And A is for auscultation. So auscultation, we're looking at using our stethoscope and listening to both sides of the chest. Now, as we're looking at the chest wall, we're aiming for auscultating here, then here, here, then here, and then just round at the sides here. And all we're listening for, comparing one side to the next, is, have we got good air entry on both sides? So can we hear good movement of air into the lungs on these areas? And is it equal on both sides, or do we have diminished breath sounds on one side and normal breath sounds on the other? And again, at this stage, we're not talking about decompressing chests or differentiating between a pneumothorax or a hemothorax. It's just enough for you to be able to obtain some information to get help and recognise the severity of this patient's condition and get them passed on to either expert care or to get expert care brought to you that can do something about those chest abnormalities that you have found. So, quick whistle-stop tour of a breathing assessment model. Like I said, there are many out there. This is one that we find is quite helpful for this particular skill group, and it's quite an easy mnemonic to remember. If you like the video, just give us a like and subscribe, a thumbs up, and look forward to more comment from us, really. Thank you very much.